Brain injury is the #1 cause of death and disability for children and young adults in the United States. March is Brain Injury Awareness Month. Here to tell us what we need to know is Dr. Audrey Halpern. She is the Executive Director of the Manhattan Center for Headache and Neurology. Doctor, welcome.
Hi, thanks.
We're talking concussion here. What's a concussion?
Well, a concussion is any alteration in brain function as a result of a blow to the head or shaking of the head. What's really important to know is that it can be as simple as that feeling of having your bell rung and a little disorientation, and that really is a brain injury.
Without unconsciousness?
Absolutely. Less than 10% of concussions are associated with loss of consciousness, actually.
So what do you do if you have that feeling of get your bell rung?
Well, the first thing that you need to do is get somewhere where you're safe and be evaluated. Many of these injuries, 300,000 to 500,000 a year, are occurring in team-related sports activities to our young athletes. So in those cases, the athlete really should be removed from the game and evaluated. What many people don't understand is that the effects of a concussion sometimes aren't apparent for a couple of days afterwards. So you might feel fine and then start to develop symptoms as the days go by. So it's really important to be aware of the symptoms and to seek help if you're having them.
What are they?
The most common symptoms of concussion are headache, but it can also include dizziness, imbalance, difficulty with mood and sleep, difficulty with memory and concentration.
How do you tell that headache from a normal headache or a severe headache like a migraine?
Well, one of the most obvious ways, of course, is that a headache that occurs immediately at the onset of a head injury is considered a post-traumatic headache and a post-concussive symptom just by definition. Sometimes people who have migraines, though, can develop a severe migraine associated with a head injury, and you probably need to see a specialist in order to make that differentiation.
At what point is an MRI indicated?
Usually for a single isolated concussion that heals as expected, an MRI is typically not indicated.
So the treatment basically, for most of them, is just to relax.
Yeah, unfortunately for many people the treatment is just rest, and we talk about both physical rest and cognitive rest, which is very difficult for not only high school athletes but most of us to do.
For how long?
Until the symptoms have resolved, and most commonly they resolve after about 7 to 10 days, but if they linger you need to continue resting until they do resolve.
All right, well, doctor, thanks for coming in. I appreciate it.
Thank you.
Thanks for the wisdom.